Welcome to Scrambled, your space for fertility, owning your 30s, and the scramble that makes it all worth it.
Welcome back to the podcast, everyone. Today's guest is Dr. Lucky Sekhon, a double board-certified reproductive endocrinologist, infertility specialist, and OBGYN, as well as a partner at RMA of New York. She's become one of the most trusted voices in fertility and reproductive health, helping millions of people navigate topics like IVF, egg freezing, fertility preservation, and family building through her clinical work, social media platforms, and her book, The Lucky Egg. What makes Dr. Sekhon's perspective especially unique is that it's both professional and personal. She's undergone embryo freezing and IVF herself, so she brings firsthand insight to the conversation she has with her patients every single day. Her mission is to make fertility information more accessible, evidence-based, and empowering, and we're thrilled to have her with us today to have this conversation. So Dr. Sekhon, welcome to Scrambled.
Thank you so much for having me.
It's our pleasure.
We are very excited. I feel like you've been a name that's been thrown around through a bunch of our guests that everyone's kind of wishing you would be on the pod, so we're happy to have you.
It's good to be here.
So you spend your days helping people navigate fertility, I guess myself included, potentially. But your own fertility journey became a part of your story too. So how did going through embryo freezing and IVF personally change the way that you practice medicine?
I mean, I think it took the compassion level to a whole different stratosphere. I always thought of myself as a very compassionate doctor, and I don't believe to be a good doctor, you have to go through the thing. But it's funny now because there's two major examples in my personal journey that I think have led to me being a better doctor, even more so than I already thought I was. One is, when I was an OBGYN resident and I was doing postpartum rounds, talking to people about breastfeeding and all the things. And now I look back, having gone through that twice and had 2 C-sections and tried to navigate the breastfeeding journey. I'm like, I wish I could transport myself back in time in a time machine, because there are little nuggets of wisdom that I learned from being a patient that I could go back and relate to those people that I was counseling. And I think by going through the process of fertility treatment, first fertility preservation, then facing secondary infertility and navigating going through an embryo transfer and being in that, it's not even a 2-week wait, but you know what I mean? Like being in all the waiting and the lack of control and having a failed couple of cycles where I was canceled for low response or only got 2 eggs, none of the eggs turned into embryos, getting that phone call. I mean, I think it just gives me a whole new perspective that I could never have had I not gone through these experiences. And I bring it up often because I don't want my patients to feel like they're the only ones navigating failed cycles or having DOR or a low response. I think the hardest part about that journey for many people is feeling like they did something wrong and their body's broken and they're alone. And that couldn't be further from the truth. So much of this is out of your control. And that's the one big lesson that I took away from being a patient, being someone who intellectually understands the science, but still couldn't will myself to have the perfect cycle and, had to troubleshoot. And also, was very much on the receiving end of that phone call where you feel like, what are they going to tell me, So I do think that it gave me a whole new perspective that I take with me every single day that I come to work and talk to patients.
Were you already practicing REI when you were going through your embryo transfers?
Yes. Yeah.
You were. Okay.
So I froze my embryos when I was still in training. I froze them shortly after having my first. So I moved up my timeline. When my husband and I met, we met in our late 20s. I can't even believe that. Like looking back, I'm like, how did that happen? Because that's not typical. Here in New York, while I was working like 90 to 100-hour weeks, okay, and he was starting his own business. And I said to him, listen, I'm not trying to be serious with you. I don't even want to have kids until I'm in my 40s. Like I have a lot to accomplish. And we very slowly became a thing. And by the time we got married, which was like 32, 33, we had this whole plan that we were going to travel and enjoy our lives. And, when I'm close to 40, that's when we're going to start trying. And of course, I check my AMH, see low levels, and I'm in fellowship training where I'm seeing one patient after the next saying, I feel blindsided. I thought I could control things. I thought I could plan for everything. And it just resonated in my brain. And I was like, you know what? You think you can control things. You think you know the science, but it's not a sure thing. And I remember coming home one day and just saying, I think I need to get off the pill. I'm worried it's going to be a struggle. My numbers look lower than they should for my age. Let's just move up our timeline. He was like, okay, whatever.
Yeah.
Like you're in the driver's seat. You're the one that's going to carry the pregnancy. And I was like, okay. And I actually was very grateful that the first time around, it actually did happen much quicker than I
Wow.
expected it to. But then
Yeah.
I was like, shoot, I had this whole grand plan of freezing because I know my numbers are lower. So then after I delivered and once I saw what it was like to be a mom, I was like, I know I want to do this again, but there's no way in hell I can do this for like another 3 years. It's so
Yeah.
overwhelming. I went back to work after 7 weeks after having a
Oh
C-section.
my gosh.
And I just remember thinking, I know I want to do this and it's so important. I come from a big family. He comes from a big family, but I just knew I couldn't do it quickly. And so right after I finished breastfeeding, like 6 months later, we froze embryos. And that's where I did multiple rounds and, didn't have necessarily the response that I thought I should for my age. And as much as I tell my patients, that doesn't mean that you're not going to be able to get pregnant. That doesn't mean you definitely have a fertility issue. This is just how your body responds to this very artificial process that relies on having multiple eggs available. It's not the same as ovulating one healthy egg. I couldn't uncouple those two concepts. I kept thinking, oh God, like, is this going to happen for me? And I had to like literally shake myself. I was like, what? This is the opposite of what you tell all your patients. So another eye-opening moment of you can be the intellectual, you can know all the things, you can understand the data, but when you're in the patient's chair, when you're in the stirrups, I mean, it's a whole different ball game. It's very hard to decouple the idea of low ovarian reserve, low response, a canceled cycle from something's wrong with my egg quality, my fertility, and having gone through that, I now understand it even more, that the psyche that goes into diminished ovarian reserve and how much reinforcement those patients need. My patients need to hear it over and over and over because we tell ourselves our own story. And there's so much self-blame that I think is inherent to the experience of being a woman. I think we tend to internalize and take on responsibility for way more things than we should.
hmm We talk about this all the time. I mean, you're talking to two women who also have low ovarian reserves. And I think it was confronting information for both of us to have. And you're right that, I mean, I as a nurse as well continued to say to myself for a long time as I was getting closer to 30, I don't want to be blindsided by this. I need to get the information. And I think it's important to acknowledge that the information can be powerful, even if it's not the information that you want to necessarily receive, because
Absolutely.
you have the ability to then do something with that. But you do need it. I mean, I was the same. I had to constantly remind myself that one doesn't equal the other, that, my quality is not bad just because my quantity is bad, but I can see why people fall into that cycle in their mind 100%.
I think it's hard also to go through that, as someone who has all the knowledge and is regarded as someone with the knowledge because it can feel a little bit lonelier. I mean, I think on one hand, it's great because you know all the things and you're not
Mhm.
afraid of the needles and you're like, oh, I know exactly what the egg retrieval procedure and the recovery will be like. There's a lot of benefits. Okay, don't
Mhm.
get me wrong. But I did feel like it was a lonely place to be in getting that call that 2 eggs didn't turn into any embryos because it felt almost silly that I was so upset about it because I knew intellectually it didn't mean all the things my brain was telling
Yeah.
it that telling myself that it meant, but I didn't feel like I could talk to that many people about it because everyone knows I know the answer, and
Yeah.
that was tough for me. That was really, really hard, and I didn't anticipate that.
It's almost like your only support system is a textbook, whereas me, who doesn't know anything, I have my doctors who are like, these are the facts. It doesn't mean one thing or the other. So I don't know. I get what you're saying. It's like
Mm.
less of a support system because you know the answers.
Mm.
Yeah, it's not that if I reached out to people, I wouldn't have gotten the support, but
Right.
it was almost like I was
Right. You
embarrassed
already
that I
knew
was
the
having
answer. Yeah.
these thoughts and
Yeah.
feelings, and I didn't even feel like I could really talk about it so much with my partner because he's like, well, you're the expert. So
Yeah.
what's the answer?
Yeah. Yeah. Yeah, totally.
It's weird. It's a weird
Yeah.
phenomenon.
Totally. But I do think that that's a valuable insight for you to have when you're helping people through the exact same situation, because you have that firsthand understanding. I think it's changed my level of compassion towards patients as well.
Oh, especially patients who are healthcare professionals, because I think
Mm-hmm.
a lot of doctors and nurses will say like, okay, yeah, no, I'm good. They play tough, right? They're like, no, I get it. I totally understand the science. And I'm like, no, it's okay to not be okay. And it's okay to ask me questions. And I'm pretending you're not in the medical field,
Yeah.
especially when they're not in this field. But even being in this field, I know from firsthand experience, I would love to be treated that way.
For sure. I'm sure you've probably already alluded to it in some of the conversation we've had thus far, but can you talk about what inspired you to actually sit down and use your knowledge and write a book that has become a guide and a resource for people that are going through fertility struggles or even just looking at preserving their fertility? What was the inspiration for the lucky egg?
I've kind of fumbled my way through everything that I've done external to patient care, whether that be, starting making content on social media, organizing events, and now writing this book. It's been always to fill a need. The earliest version of that looked like a blog that I started in 2019 called The Lucky Egg, obviously. And it just became a place for me to put longer form content. And then Instagram started Reels. That's how far back this goes. This was like before the days of Reels. It was just
Yeah.
like, photos on your grid. And then Reels, I was like, this is kind of interesting. And I haven't deleted any of mine. You could scroll all the way down to the bottom of my grid. Maybe I'm going to regret saying this, but I left all my cringy Reels there because I didn't know what I was doing. Like no one knew what to do, right? But like I was started creating this more dynamic content. And then it became clear that a lot of the really intricate conversations around these very scientific topics that can be so nuanced and individualized for a given person and their situation, it didn't lend itself well to that anymore. And I still do it, obviously, but the algorithm only favors and shows your video if it's less than 3 minutes and your character count has to be less than like 2,200 characters or something like that. So it doesn't leave a lot of room for nuance. And that's where I had the craving for this long form content. So yes, of course, I can write a blog as long as I want. But I also felt like that wasn't cohesive. I get so many DMs every day being like, do you have a blog on this? Do you have a post on this? And I needed an index. And I was like, I feel like that's the natural transition that I need to turn this into a book. And at the risk of sounding like a wannabe Carrie Bradshaw, I was like, I got to turn my column into a book. And so that's what I was trying to do with my blog. I was like, okay, I'm going to take this long form content and basically organize it in a way that starts with the foundational knowledge that everyone should have starting in their 20s or earlier, right? About what their cycles mean. What does it actually mean to get a period? A lot of people get periods month after month and they have zero clue why and how. And that needs to stop because that knowledge gap is where issues like an 8 to 10 year delay in diagnosis for endometriosis or PCOS, now called PMOS, or women finding out only in their late 30s or early 40s that they have huge fibroids that are the underlying cause of their really problematic cycles and maybe even infertility. I mean, people aren't in tune with what's happening with their body because no one is really teaching them that. The last time a lot of people have thought about these topics were health class, where the goals were very different. And that was a long time ago. So I kind of framed this as health class 2.0. I feel like this should be mandatory reading for everyone entering their adult years, even if they feel like they're light years away from being in a position where they're ready to start having a family, because you don't know what you don't know. And I think that leads to a lot of unnecessary anxiety, worry, even about the biological clock. People assume when they turn 35, it's going to be like Cinderella, her carriage turning into a pumpkin. They think their ovaries are just going to like poof, disappear. And it's like, no, 35 is not a fertility cliff. There are plenty of women out there at 38, at 40 that are able to ovulate a healthy egg and get there without the help of a fertility doctor like myself. But you need to balance like the panic and fear with being overly complacent, because I also see a lot of women for the first time having these conversations with me where they're like, I'm on the pill, I'm 47, I'm 48, I don't know, like, what are my options? And so you see these two extremes. And what I would love to see is finding like a middle road where it's like, don't panic, Don't be overly complacent. Just understand the reality and the facts so you can make an informed decision. And my goal isn't that everyone freezes their eggs or everyone decides they want to have kids. Of course not. My goal is that everyone feels like they were given the information they needed to make an informed choice, and that there will be way less women in their 40s and 50s looking back on their lives and saying, I would have made different decisions had I known different. Right. And that's really the goal here, is to inform people and make them feel knowledgeable enough to make the right decisions for their body.
Knowledge is power. It was interesting. We recently took to the streets with little microphones and we were just interviewing people that were willing to have a chat with us and asking them very broad questions. And like one particular question that got a lot of traction, we asked people, how many ovaries does a woman have? And not many men that we spoke to knew, but the amount of women that didn't know the answer was very, very interesting. So you're right.
Shocking.
It's shocking. How do you not know you have two ovaries, left and right? That's like basic anatomy, but people don't know.
They don't.
No.
They don't. And the more resources that are out there, the better. So a book like yours, yeah, you're right, it should be mandatory reading. I think France were doing an initiative where they were texting people in their like late 20s or early 30s to tell them.
They actually sent a detailed letter to all 29-year-olds, men and women, where they explain what is the biological clock, what is the science behind reproduction. Because the truth is, people think that the minute they start trying, they're going to get there. They're going to get pregnant, because that's the framing during health class in grade school, right? Like, don't have sex, you're going to get pregnant. And the reality is so much more nuanced than that. And it also would make people feel a lot better. So many people come into my office crying because they've been trying for 3 to 4 months and they think something's seriously wrong. And I'm like, you're just normal. Human reproduction is inefficient. You just need to know when to seek help.
Oh my gosh. Yeah. It's crazy too. Another one of the questions we asked is, what's the % chance you get pregnant if you're ovulating, you have sex on perfect timing? And everyone's like 80%. By the way, men guessed lower numbers for that, 20%, 15%. Women guessed 75, 80, 85.
That's so interesting.
Yeah. I think it goes really back to the responsibility on women in their teenage years is usually that birth control is a responsibility of a woman. So I think they have aligned that idea of sex equals pregnancy potentially. The initial health classes you do, which don't go into talking about the next step of what reproductive health actually looks like when you're trying to conceive a child. It's so interesting.
It's so interesting. One of the main themes in your book is fertility, fact versus fiction. And you just touched on one, 35 years old, I can't get pregnant. What are some other ones that, you believe are biggest misconceptions or the biggest myths about fertility?
I think this idea that there's a magical set of supplements, a formula to follow, like just do this and you will be okay. That is probably one of the most damaging myths and messaging that's laced with myths that is out there, because it is predatory, it is misleading, it gives people false hope, it makes them more complacent than they should be. It often veers them off of the path that they should be on, whether that be just time your cycle, stick to the fundamentals, try for a certain amount of time. People are pausing and thinking that they need to go on a cleanse for 3 to 4 months. Sometimes they're doing extreme diets. So a lot of these behaviors lead to extreme habits that actually might be counterproductive and take you further away from your goal, whether it's, saying I need to cut out all forms of exercise and I need to just eat this one superfood. And all of a sudden you go from being someone that was relatively balanced to being off kilter. And it's not only that, it's a waste of valuable resources. I'm not just talking about money. People do spend thousands of dollars on supplements, believe it or not. And when you put that next to how bad the data on supplements is, it doesn't make any sense that that's where all of the fodder and attention tends to focus on. But it's this wanting to have control, wanting to make sure that whatever levers you can pull, you are pulling. And people know this. And so, just by virtue of being someone who's trying to conceive, we need to start thinking about ourselves as a vulnerable population, because we are. And the same goes for women who are pregnant and parents early in the game, because you are in a period of your life where there's a lack of control and you're desperate for anything that makes you feel like you're sure to have a better outcome. You only want the best for your future family. You only want the best for your children, right? And I think playing into that fear and anxiety is a really easy way to manipulate someone. Saying fertility is just a female problem. I mean, we still get that narrative till this day. I think that the word is getting out there, but it shouldn't be shocking at this point in 2026 that 50% of couples with infertility have a male factor because it takes two, right? It's a 50-50 equation. But I think there is a bias against women in society when we think about the burden of infertility and pregnancy complications. A lot of it is really female centric because we have this biological clock where we don't make new eggs and we don't repair our eggs. Men are always making new sperm. So they have this air of invincibility. That's how people view them, right? But we know that male age can play a role. We know that habits and chronic medical conditions can affect sperm quality in a way that can really limit fertility. It can also contribute to certain pregnancy risks and outcomes because there's a major contribution of paternal genes in how the placenta gets built and how it functions. And this in turn can also affect the future health of children down the line. So it really is 50-50. When I talk to couples about lifestyle changes and things to focus on, I'm talking to both of them.
It's funny. That was literally my next question to you was going to be about it's almost like it is a misconception that fertility or infertility is a woman's problem. It's not, like you've just acknowledged. How do you think, or what is the approach? How do we get men involved in this conversation and maybe interested a little earlier?
Well, one thing I love to hear, and I hear this every week from patients, from people that follow me on Instagram, that their partners are reading my book
Oh my God,
alongside them.
amazing.
Yeah, because they're getting informed. And I honestly hope that this is how one of many ways that this resource is used, because I do think one of the most annoying, difficult aspects of being a patient, on top of the burden of all the things you have to do and go through, is the need now to educate everyone around you, right? Well meaning friends and family members are asking you for updates, they're asking you questions, and they are trying to show up for you, but they're actually burdening you with the task of now starting from scratch and educating each person that wants to understand the process better. And I think, for partners, they have a different focus in their lives. They haven't been thinking about how many ovaries they have. They don't have ovaries, right? Like that's not
Mhm.
top of mind for them. So I think it's even better to give them resources to say, read this, get familiarized. I think it's so important if you're in a relationship to make sure your partner's coming to those visits. They can join virtually. I mean, it's never been easier than it is now. But I think too many people are leaving them out of the conversation thinking this is too much. Maybe, some of them are thinking this isn't sexy. Like, this isn't how I want my
Mhm.
partner to view me. I don't want them coming to my monitoring visits. At first visits, sometimes the first consultation, I'll tell them, both come in. We're going to do the scan. I'm going to show you everything that I just drew on this piece of paper while I was explaining the science behind it all. You're going to see it in real time. And I show up to do the scan, and the partner's in the waiting room, not because they didn't want to be there, but because the patient said, I actually don't want them here. So I think fighting that urge to say, oh, I need to have some sort of veneer of this is the version that they see. I mean, you have to be vulnerable and take your guard down. And I think involving them early and often in the conversations and in the education process is going to only serve you. It's going to make them be able to better show up as your support. And they are going to have really insightful questions for your doctor. I mean, it's a team sport, right? It shouldn't just be one partner. It should be both really rowing in the same direction.
Totally. And I think to the point like you've been making, that knowledge is power. And a lot of the time, men don't know it. I mean, a lot of the time, women don't know their own anatomy and things like that. So if they can be a part of the process and a part of learning it with you, alongside you, just by default, they're going to be a bigger part of the picture because they're going to want to be more involved, because there's not that nervousness around, like, I'm going to ask a stupid question,
Mhm.
if they're a part
Yeah.
of the learning process.
Yes. Yeah, and that's the other thing is you never want to put your partner down for not knowing the basics. Like, I
Right.
think really bringing them in early, and I talk a lot in my book. There's such a huge mental health component, and I talk about how this can be tough on relationships. And some people will say it brought them closer together, and other people feel like it really drives a wedge between them. And it can look different ways, but I think it's all in how you react and approach it. And the earlier you make a concerted effort to include them, I think the better it goes. I also think that you need to create kind of scripts or, a mechanism to communicate because everyone has different ways of coping with stress. Stress plays out in different ways. And I think we have to be understanding that if your partner doesn't look the way you think someone should look after getting a bad, phone call about the egg retrieval results, or you find out you had a miscarriage, grief can look different in different people. And I think that that's a source of conflict for a lot of people is feeling like my partner, does he care? He just seems to be getting on with life. And it's like, well, maybe he's really just trying to suppress his emotions, And so I think decoding that and helping people really relate to their partner and talk about these hard issues and giving them kind of prompts to do so is a helpful tool that I've learned from a lot of the mental health experts that have collaborated in the care of my patients. So it's as much a mental game as it is a physical one. And I think when you throw partners, relationships, all of the other stressors that we have going on in our lives into the mix, it just makes everything more complex.
Yeah. And I think too, a lot of couples never experience this type of stress or grief until something like this happens.
Yeah. This is like their
Together, at least
first major
together, yeah.
life challenge for a lot of people.
Yeah. So you learn something new about these people, but it's always why I think in my head, always make sure you pick the right one.
Exactly.
Yes.
Exactly.
It's important. It matters who you pick. And that kind of leads me into my next question. So obviously age and biological clock. I, for one, am 32 now. I'm single. I have low AMH, obviously. On paper, none of that sounds good. So can you talk a little bit about age, biological clock, things you can do, misconceptions, etc.?
Yeah. I mean, I think the hardest misconception to get past is decoupling egg quality and quantity, right? We're born with all the eggs we're ever going to have, about 1 to 2 million on average. And by the time we get into menopause, which on average is 50-51 in this country, that means you've fallen below a critical threshold of less than 1,000 eggs. And that's when your ovaries become resistant to the signals that your brain normally sends to the ovaries to try to get you to ovulate. And that's when you stop ovulating, and not getting a period for a whole year is by definition menopause, right? And there's obviously a very long preamble of perimenopause, which can be anywhere from 5 up to 15 years of this transition where your cycles become a little erratic and your ovaries don't always show up and respond. But people have sometimes diminished ovarian reserve, which it's all relative. It just means you have a lower egg count than what would be normally expected on average for your age. So what's considered DOR, diminished ovarian reserve, in a 20-year-old is maybe normal or even good in someone in their early to mid 40s. And what's considered high and what's actually beneficial to you are two different things, because ovulating 1 egg per month, right? And so your AMH, which is a marker of your ovarian reserve, your numbers, your egg count, none of that has anything to do with your ability to ovulate randomly 1 egg and for that to actually turn into a baby. And so that's the other big misconception. But I think it's not wrong to be appropriately concerned and want to be proactive if you have known low AMH, because you don't know, are you going to be at this low level for quite some time? Is it just going to stay consistently there and not really be changing in a progressive way over the next few years? Or are we catching you on a trajectory where this could be speeding up and could lead to early menopause? Studies have not really shown that this is a way to really reasonably, reliably predict exactly when that's going to happen. And, people have looked at this and said, okay, well, if your AMH is less than 0.3, then average duration to menopause is like 6 years, but the standard deviation is so wide. It could be decades, right? And so obviously you want to be careful, because the worry is that if your egg count is very low, eventually it may be hard to do an egg retrieval, because an egg retrieval is essentially hijacking our normal system, which is your brain sending a signal, 1 egg being the one that matures and ovulates, and then the rest of those other eggs, whatever we have access to, just dissolve and go away. There's a lot of waste. And so an egg retrieval is us saying, let's make use of this waste and say, let's give you shots of that same hormone signal at a higher level to try to get multiple to mature and be extracted. But if there's only a few there, then you're limited to working with a smaller number. I don't know how to pull more out from the storage unit.
I mean, wouldn't it be good if we did?
Exactly. It would be great. It would be great. But the other side of that coin is people often worry about doing egg retrievals because they're like, you're going to deplete my reserve. You're going to put me into menopause early. And I'm like, I kind of wish I knew how to do that, but we don't, right? If I knew how to do that, I could guarantee everyone would have a successful high yield egg retrieval. But because I'm limited to working with what your body would have wasted anyway, it's not going to deplete your egg count and put you into menopause. It's merely salvaging and trying to make use of what we have access to that your body would have wasted. So that's why egg count matters. So if you're not going to be going through treatment and your level just happens to be low, then it may never even be a problem. And I've had plenty of patients with diminished ovarian reserve that proactively, like yourselves, went through egg freezing. And then they're emailing me years later saying, oh, I don't need to use my eggs. I've had 2-3 kids, no issues. Great. But on the off chance that there was a rainy day and you did have infertility, of course, it would be easier to give yourself a head start with more eggs that you retrieved at a younger age if and should you need IVF. And that's how you should really think about it.
Yeah. And I think
really
it's
interesting.
Yeah.
The way you just phrase that is really interesting because, of course, I know all of this, but
I know because a big question I get asked, and you just explained it very well, is someone who maybe does multiple cycles like you did often say to me, like, well, why in one cycle did I have a higher reserve that month and I did in the other? And I'm like, well, that's not how I think people do get confused by the concept of doing an egg cycle isn't diminishing the reserve.
Yeah.
We're working what is available there in any given month.
AMH can fluctuate too. I was always so curious about that because one day I had 0.1 and the other day I had 0.7. And of course it's still below 1, but I'm like, how do I get higher randomly?
Well, AMH is being produced. It's a hormone being produced by all the little cells that line each of the bubbles of fluid, the follicles that each contain one egg. And so, of course, if there's a cycle where you happen to have more eggs escape from the pantry of both ovaries, so to speak, you're going to have more AMH detected. It's just a marker of what's available in that month. And it's not going to differ wildly from one cycle to the next. And one could argue like 0.5, 0.7, 0.4, it's all kind of within the same range. But it makes sense. Any hormone test that you keep repeating over and over, you're going to get slightly different levels. And it doesn't mean that you gained or lost eggs in that short period of time. You're kind of taking like a step back and just looking at the overall picture rather than making any sort of knee-jerk reaction or having a knee-jerk reaction to any like small, minute shifts. The other big thing, though, to really understand is egg quality. And egg quality is such an abstract issue because there is no test for egg quality. I talk about this all the time. When people say, my doctor told me at 30 that I have the eggs of a 45-year-old, I'm like, no, what your doctor meant to tell you is that your egg count seems more typical of what you'd see in your 40s, but your eggs are still 30 because you're 30. And what I mean when I say that is over time, the eggs sitting in our ovaries, they're more prone to breakdown. There's actually these proteins that hold your chromosomes together. And those proteins are very prone to break down with aging and they don't have repair mechanisms. So every time you go through an ovulation and every time an egg gets fertilized, what's happening inside that egg is very interesting. It's going through genetic reorganization. It's like turning its closets over for the season, basically, right? And in that process is when errors occur, when like the wrong number of chromosomes end up in some of those cells, and that then can result in an embryo with missing or extra DNA. So that is very much something that can happen to anyone in our 20s. You don't have perfect eggs. And certainly as we get older, they become less perfect, right? But they were never perfect to begin with. So even in your 20s, 20 to 25% of embryos coming from your eggs might be abnormal and not result in a baby or could result in a miscarriage. And that's what we're starting with. And then that proportion kind of just increases, not in a linear fashion. It starts to really experience an uptick over 35. But again, at 35, it's like, okay, a third of the time an embryo is going to be abnormal. 2/3 of the time it's going to be fine. So you don't need to worry, right? And at 37, 38, it's 50-50. So you still have normal eggs to ovulate even in your 40s. It just might take many more lottery-like ovulations to get that healthy one, that lucky one to actually result in a healthy baby. And there could be higher rates of miscarriage, but it is very possible.
Yeah. Thanks for explaining like it like that. I think
that
it
was
does
really
make
helpful.
it make a lot of sense. Can I ask you maybe from obviously a professional, but maybe also a personal perspective, because you spoke about how you maybe shifted your timeline based off of the information that you got about yourself. And I know you're raising 2 daughters, or you have
2 daughters,
two
yeah.
daughters, right? Yeah. So
6-year-old
what
and a
advice would
9-year-old.
Oh, wow.
I'm
So
one of 3 girls. So good luck.
at what point as women, and what advice will you give to them when the time comes? When do you think women should be a bit more proactive about getting this information about themselves, about maybe even just seeing where they're at based off of maybe their
Yeah.
AMH level?
Well, I want to be clear that it wasn't just because my AMH was lower. It was more just the eye-opening experience of seeing so many women come in and following their stories. I was in training and I was like, wow, I kind of felt like prior to this experience, even as an OBGYN resident, I'm in women's health, I kind of overestimated like what can IVF accomplish and overcome. And I kind of overestimated, how sure of a thing egg freezing can be. And I do think they can be wonderful, but I started to respect biology. Let's put it that way. I recognize that, there isn't a test for everything that there should be. There's no way for me to test my egg quality. I can't for sure say any steps I take now to be proactive are for sure going to pan out later. And what am I waiting for? I kind of recognize this common thread in hearing and seeing all of these people's stories and situations that you can't always wait for the most perfect moment. And so it kind of just shaped the way I started thinking about my life. And I was kind of like, I went from being like, oh, I have to finish all my training and do all my board exams. And then we have to be married for a certain amount of time. And we have to feel like we lived our lives and we saved enough money and blah, blah, blah. And it's like, there's never going to be a perfect time, Lucky. Just dive in. And I was so scared when it happened. I was like, oh God, I had it baked into the equation that it would take a long time. Right. And then, it's interesting because like I went through secondary infertility and then I went through a little bit of denial there because I was like, oh wait, I planned for this, but I didn't actually think it would happen. And it did happen. And even my husband was in denial about it. He's like, what do you mean it didn't work this month? I'm like, I'm 37 and 38. Like, this makes sense. Why are you shocked? But
Yeah.
I think, that was really the reasoning for me. But obviously having the lower AMH made me think if I ever run into problems, my AMH will be even lower then, and then it'll be harder to be successful should I need IVF. So that's how I was thinking about it. But I think, listen, the message isn't everyone needs to go run out and get their AMH checked. But I'm a big believer. I don't think enough people are doing even a basic pelvic ultrasound. Like, I think people are waiting until there's a symptom of a problem, heavy, painful periods, irregular periods, and then it's being ordered. There are also no standards. So some people are like, oh, my OBGYN, just did it just as a screening. And I'm like, that's awesome. There's no guidelines, right? So I think even just let's start with that basic nugget there, which is some people don't even have an OBGYN. Get an OBGYN. You're in your 20s. Start paying attention to your cycles. Talk to them about what's going on with your cycles. Are they irregular? Are they painful? Get at least one pelvic ultrasound is my advice. This is me going totally off script because as a doctor, we're supposed to follow the guidelines, but I've seen the damage that gets done when people just wait till there's a problem. And then it's like all about, rushing to play catch up or put a Band-Aid on it. And I think it's not a big imposition to get at least one ultrasound just to say you've looked at your internal pelvic organs and everything looks okay. And then, I'm also a big believer in getting your AMH checked periodically because if you find on the off chance it's extremely low compared to what's expected for your age. And I actually have a great calculator on my website, The Lucky Egg, where it's based on an actual paper of 17,000 patients that came to fertility clinics and had their AMHs checked at varying ages. And just to see, yes, there's a wide variation, right? But are you kind of within the norm for your age? Just to see, I think it's helpful information and we shouldn't be afraid to get it. And I think a lot of OBGYNs sometimes are reluctant to send one off because they're like, well, it's not really a fertility test. And they're right. And they're worried about it causing, this effect of having like a gray cloud over your head everywhere you go because now this knowledge that your AMH is low. But it might not be low. And then that's also not reassuring that you can just like do nothing and come back at 45 and it's all going to be good, right? So it's like about navigating that balance. And I think it's about getting that key education and trying to spot red flags before they become an issue so that you have recourse and you can do something about it.
I think we've had conversations with a lot of people that have shared their experiences with doing IVF or doing egg freezing. And I think as women, the narrative that keeps coming up is that we do ignore things or we put things down to other things like having irregular cycles and even the length of time it takes for people to get diagnosis for things like PMOS. And it comes down to, I think, like, we need to stop doing that. We actually need to respect our bodies a little bit and listen to what it's telling us, not ignore it, and be willing to go and have conversations and ask for help from doctors, I think is a important
Yeah.
step.
Yeah, I was going to say, I always say I got very lucky. I had an ovarian cyst rupture. And as much as that sucks, that was the first time I had a pelvic ultrasound. The hospital did it. They sent it to my primary, who is my OBGYN. And she looked at it and she said, I'm going to refer you to the fertility clinic. I think you should just get everything checked. And that started everything for me.
Yeah. Yeah. And that's the story for so many people. So,
Yeah.
and then it's also a PSA is if you have a really low egg count compared to what's expected for your age, that may lead to another line of investigation of why, and then what we might uncover is, oh, you have really painful periods and you have a long line of, female relatives with the same type of thing. Your mom had a hysterectomy in her 40s. Why? Oh, we don't really know why. Maybe she had endometriosis. Endo is one of those really big causes of diminished ovarian reserve that, sometimes it leads down a different line of investigation and opens up the possibility of a different diagnosis. And I always, I take the rule of if I see something, I say something. When people come to me to talk about egg freezing and they're just like electively there to just have a chat and learn, if I see fibroids or I see a sign that they could have endometriosis or any issues when I'm doing their scan, I talk to them about it. I open the can of worms because I want them to be aware. And maybe it's not even relevant to their current timeline and what the goals are right now. But I, again, just think knowledge is so much power, and we really need to be more proactive and doing these checkups. I think, for everyone in their 20s so that they have the lay of the land.
Yeah, I agree. And I think just the sentiment of the whole conversation has been that knowledge is power. So having these conversations, I think, is super important. To close out our convo with you today, Dr. Sekhon, we're going to give you some rapid fire questions.
Let's go for it.
All right. So if every 25-year-old male and female could receive one piece of advice in a text message, what would you want it to say?
Fertility is fleeting and you need to prioritize your personal goals because your job will always be there. And I think that we often deprioritize our personal goals in favor of professional ones, but it doesn't have to be perfect and you don't always have to do something within a discrete window of time. I think that we need to be keeping our personal goals at the forefront of our consciousness, even well before we feel like it's relevant, because it's really easy to get on the hamster wheel of life and time goes fast, So it's really about keeping that in mind.
Yeah, time moves fast.
Crazy. Fill in the blank. The biggest mistake people make when thinking about fertility is
that they can control every aspect of it.
Yeah, I think we love to have control.
Yeah.
every human being.
Now, I had to edit this because I originally wrote what is the most Googled, and then I realized we're using ChatGPT now. So what is the most Googled or AI asked fertility question that makes you cringe as a fertility doctor?
Trying to look for the zebras. Like people are always like asking, I think they're putting in prompts and I'm just guessing based off of the things that get brought to me. And I don't mind, to be honest. I'm like, okay, great. Like whatever tools you can use to ask better questions, go for it. But sometimes you can tell that the line of questioning is very much like, I want to expose like the rare thing, like the most rare thing. And I want to talk about if I do 10 transfers and the 10th one doesn't work, what would you do for me? And can we do all that now? And I'm like, it's not that work. So I think that's probably the main thing, just because I think it's not always a productive exercise. And it can make you feel more afraid. Recently I posted something, don't even remember exactly what it was, but it was more in the comment section of one of my posts where it was something about like someone saying, I went through IVF and I'm not trying to trigger anyone, but for me, it was kind of easy. I didn't say this. Someone else said this. She was just sharing her experience. And there were a bunch of people in the comments saying, actually, this was super helpful to hear, because I think just like when you look up reviews online, you're like, who are the type of people that write reviews? A lot of the accounts that you see talking about their journey, it might be that they finally feel like it's worthy of sharing because it's this extreme version of reality, right? And they're like, oh my gosh, like, let me tell you, I've been through some stuff, right? There's a lot of that. And also there's bias towards only people sharing after they've been successful. Like there's a lot of bias in what's getting reported and shared online. And so I do think that there is something to be said for people needing, to see the positive journeys, the positive outcomes, not to sugarcoat or glaze over the hard stuff, but to kind of show people like there are people that do one cycle and get there. Like I think a lot
Yeah.
of people shy away and delay moving on to IVF when it might be the right thing for their diagnosis and their situation because they're like, well, I don't want to become one of those IVF long haulers where I'm going to be just like constantly in this spiral of doing cycle after cycle. And it's like, but there's a lot of people that don't do that, So I think we have to be very careful about the content we're consuming and recognize that it's a highlight reel and it's not going to tell you globally, like what is the experience of everyone who's going through this and going through various types of treatment.
Yeah, 100%
That's a good
agree.
one.
I have a friend who's pregnant and she sort of said the same thing. She goes, every birth story I'm hearing is traumatic. Can someone just tell me a nice experience about having a baby?
Yeah.
Same
Exactly.
concept.
I posted my C-section video
You
years
did?
ago. Years ago. It was like C-section awareness month or something like that. And I don't know what came over me. I don't even know why I did it. I just was like, this is a cool video. How many people have a video of their C-section? The anesthesiologist wasn't supposed to take the video and he did. And I actually just wanted pictures, but he was just rolling. And so it was the most viral. It was like one of my first viral posts. And I did not expect that because people were like, oh my God, this helped me undo the trauma of my birth because I had to be put under anesthesia for an emergency C-section. And now it's so calming to see like this is what actually happened during that process. Or some people are like, I was so afraid that I have a C-section scheduled in a month from now. And this just made me feel so much calmer about it. So I do agree, like we need to share all types of stories. And I think people are reluctant to share when things are quote unquote easy and straightforward because they feel like they haven't earned the right to share. They haven't had enough pain. There's like this pain Olympics that happens in the fertility community online, but everyone's story is valid and you don't have to have suffered a certain amount to be able to share your story.
Yeah, totally agree.
You are a social media guru, as we've spoken about. If you could bust one fertility myth in a 15-second TikTok, what would the headline be?
The headline would be that you're not alone and this is not your fault. This isn't because of something you did or that you didn't do. It always feels like you are running to play catch up and, be abreast of the hot new test or treatment. And it just feels like this is such a fast moving field and, you have to be on the forums and searching. But at the end of the day, I think, the options that are valid are much simpler than what people assume. And I think sticking to the basics and the fundamentals and finding a care team that you can trust is really the key.
Love that.
Amazing.
Thank you, Dr. Sekhon. This has been such a fun conversation. Would you just give us, and we'll put everything in the show notes, but where can people find you if they're looking for you as a doctor, if they're looking for your book, your resources, your social media?
Yes, thank you. I see patients full-time at RMA of New York. I'm based in our Soho office, but we have offices throughout New York City. I am on Instagram at lucky.sekhon, Sekhon. I have a website called theluckyegg.com. It has links to where you can get my book, but my book is everywhere, and there's an audio version that is narrated by me. There's an ebook, but I would really appreciate for anyone who is reading it and is finding it helpful to share their experience online in the form of reviews. And I have my own podcast now with my best friend who's an OBGYN and a midlife menopause expert. It's called Call Your Doctor. And we talk about puberty to menopause, everything in between, anything to do with hormones. We're your girls.
We love that. All right. Well, thank you.
Thank you so much.